Call the meeting of the Sawyer County Health and Human Services Board to order. First item on the agenda is the meeting agenda. Is there any changes to it?
Want a roll call, Bill? I don't
Yeah,
think
there
you're.
it is. Okay. Yes,
Is Chuck Manhattan? Lorraine J, Dr. Dunlap?
no, Dr. Dunlap is excused. She said she had other duties.
Okay, that's it.
I'm here.
Who's on?
Dawn Pettit.
Gotcha.
Is anybody else on Zoom? Okay. What does Dawn do if she wants to speak?
Just checking in, I think.
Oh, just check. Okay,
I
now
know
the,
there's, okay.
okay, now the agenda. Any questions or concerns about the agenda? Any motion to approve it as is?
Motion to approve.
Second.
Any further discussion? Hearing none, everybody in favor of approving the agenda as is, say aye.
Aye.
Aye. Any opposed? Motion passed. Minutes from the previous meeting.
Motion to approve, Mr. Chairman.
Thank you. Motion by Mr. Olson.
I'll second it.
Okay, second by Dawn. Any discussion? Any changes? Okay. Everybody in favor, say aye.
Aye.
Anybody opposed? Same sign. Motion passed. Audience recognition. Is there anybody in the audience who wishes to speak at this time?
I would love to speak. Just for a couple minutes?
No, I said no, not at this time. I want Paula to have a crack at this first. Okay. Hearing on the 2021 budget. Is anybody here to speak on the public hearing of the budget? Okay, hearing none, we'll move on. Committee member orientation. Who's up tonight, Paul?
So that was if you had this on there and you wanted them to look at the bylaws, if they had any questions, they could bring them to the meeting tonight.
Thank you. People had a chance to look at the bylaws, gone over them? Is there any questions or concerns? So we,
Pull it back up again.
pardon?
I'm trying to pull it back up again. Are there any changes or anything, Paul? with the
No, these are the ones you guys approved.
Okay.
Still got.
Okay, no further discussion? We don't need to approve them, we already approved them. Okay, we'll just move on then. Bylaws, committee reports. Is Ms. Goulet here?
No.
she doesn't.
No.
Anybody else? This is the latest, okay. Senior Resource Center, I believe everybody got a update from them in their packets.
Joey's on. Joey Johnson's on.
Hi, Joy. Do you want to add anything, Joy?
All right, you can talk.
She's still muted.
I can't unmute him from here.
Pardon?
There we go. She's Joey.
Yeah, I'm here.
Did you want to add anything to your written report?
I don't think so. It's been a while since I've been at a committee meeting, and I just thought if anybody had any questions, I'm here to answer them tonight. But everything is going pretty good over here.
Good. Okay,
All right.
thank you very much. Appreciate
You're
you being
welcome.
here.
What about the other, Mr. Chairman, what about, Joey, are you still on there? What about our other sites, like the one in Winter? Is there any-
Okay, the one, we still have Winter and Excellent combined because the numbers are so low. Combining Winter and Excellent, we're still only doing somewhere between 35 and 40 meals every day. So it doesn't warrant the expenses that we have for the Winter site to continue that. And since we've combined the two, for example, the electric bill and some of the other bills have, gone down, and it has saved on our food bill also. It's been more economical all around by combining the two sites temporarily. But now in July, we're going to go around and do all of our site visits and figure out what our reopening plan is. And so then at that time, when we do the reopening, we'll talk about when we're going to reopen Winter along with all the other sites. But right now, it's more of economics why we combine the two sites.
One more. And Joey, you probably are aware that we're considering California Avenue, extending it down there below you between the creek and your building.
That's what I've heard.
Yeah, Joey, do you have any concerns with that being a street and there's more traffic possibly by there?
Well,
Senior Center have any concerns?
Typically down below where that's going to be, it's staff parking down there, except on the days that Jody has her health promotion classes. So there's a lot more people in the parking lot down there. I don't know how much traffic it's going to be down there, but I think it will be okay because in all actuality, when the city did the redoing of the city water and sewer, it actually made our parking lot down here not number wise as far as parking, but it made it wider. So it's more convenient for the bus the way it's coming in now. We're coming in the opposite direction. It would just depend upon, what that traffic's, going to be. I think it's going to be okay. It's wide enough, but you don't know, how much people are going to use that road. They're going to use it for a lot at the beginning because they're going to be curious like they are right now. They're coming down that road and looking, and then all of a sudden they see the great big piles of dirt and then they turn around and leave. So there are no really big concerns, Tweed.
Okay, thank you.
You're welcome.
Anybody else have any questions for Joey? Okay, thanks again, Joey.
Oh,
Yeah.
you're welcome.
Cool.
Anytime.
Somebody, hang on a second.
Lori Perlick has her hand raised. Did you have a comment at this time, Lori?
Well, actually, my hand's been raised since number 4 regarding audience recognition.
Well, I apologize for that. I thought somebody was going to tell me because I don't have it on my screen.
Just saw it, Dale, sorry.
Oh, okay. So I do apologize for that. Please, talk to us now.
Well, I wanted to make a comment regarding the public hearing notice for the advisory committee. First off, I'm bringing this to the attention to raise awareness, not to point fingers or to place blame. Firstly, it took 2 requests to even get a copy of the public notice. If the goal of the public notice was to give our target groups and our residents an opportunity to speak to what's important to them within the Health and Human Services community, it was very difficult for them to know that this opportunity existed. Once I did receive a copy of it, I almost wish I had not. If you had read that it refers to requesting information from services that are provided to the elderly and the handicapped. Handicap has been a derogatory term within the community of people with disabilities for a number of years. And it's very unfortunate that it continues to be used when it is seen as being so derogatory. So it's my hope, and by bringing this to your attention so that in the future, for any postings, that the emphasis is put on the person and not their limitations, and that we are treating our people with the dignity they deserve. And I thank you for the opportunity to have my say.
Thank you, Lori, and I agree with you. I had a daughter born with cerebral palsy, and handicap is not the word we like to hear. So I appreciate what you're saying, and whoever wrote that, maybe we can change that in the future. Any other comments? All right. Senior Research Center. Somebody got me what I do with page 2. I'm sorry, what is the next one? Okay, yeah.
Coronavirus update.
Mhm.
Julia's dog is on the line.
Julia, Alex does have your PowerPoint.
Are you there, Julia?
Okay, I got a quick, I have people, so just, I hope you can all hear me okay. I am having a lot of trees cut at the moment. Of course, come right when the board meeting's on. But, so go ahead and we can go to the next slide. And so where we're at right now with cumulative cases, we have 13 positive and 1,897 negative. And as you can see, we started kind of mid-March and have been continuing to get some positive cases right up until actually yesterday. I got my last positive case that brought us up to 13. Next, please. And so one of the new data sets that I wanted to be able to share is the state is now providing us data, which I'm very thankful for, because this would be something that I would have to try to figure out how to do on my own, which we could do, but it takes a lot of time. So it's nice that the state is doing this for us. So this data reflects 2 weeks of data, so it gives us current data as to where we're at right now, and it's as of July 1st. So our count within the last 2 weeks as of July 1st was 3 positive cases, and they put that at a rate of 100,000, and that gives us apples to apples information. And so that rate is 18. That gives us a burden of a moderate case rate, and when we look at that, it's anything over 10 and under 50. That would give us a burden rate of moderate. So you see us as medium color on the chart. We're on our trending or trajectory based on our previous and past notifications. We're about the same, so no significant change. And then what they do is they take that rate, the burden, and the trend data, and they give us an activity level. So right now we're at a medium activity level of COVID in our community. Are there any questions on that before I go on to the next slide?
How does it factor
Oh,
in?
hang on.
Oh, I got a question.
We have a question.
How do we factor in any of the tourism or any of that into our numbers?
So, you know, we are doing incredibly well. And I think the reason for that is the type of tourism that we're getting is mainly families, people that are coming up and doing a lot of outdoor activities. And we're not, the areas that are seeing these really high case rates are the areas that have like the 18 to 29-year-olds. They're college towns and they're hitting the bars pretty heavy. And that is really right now where it's really trending, and really the tavern and the restaurant scene with more elderly, we're doing better at social distancing or physical distancing in these areas. So I can tell you of all of our positive cases too, this might help. There is nothing associated with an event at this time or a restaurant or a bar or anything of that nature.
Okay.
Okay, next slide, please. So after Safer at Home, we look at what are we doing to control disease. And so what I've been talking about for a long time, these recommendations are continued, and it's physical distancing, wear a mask when you're not able to keep 6 feet of distance, frequent hand washing, and keeping your circle of close contacts small. What's new for you in this slide is there are some new recommendations for what is considered a close contact. So these are things that you'll want to think about. If you have a physical contact with a person who's positive, a handshake, a kiss, or a hug would consider you a close contact. And that's where the 18 to 29-year-olds are really spreading. The kisses and the hugs are definitely getting them into trouble. Anybody within 6 feet of distance for more than, or 6 feet with a person who's positive for more than 15 minutes. Again, this is the other thing that's happening with 18 to 29-year-olds. And then if you have any contact with somebody with their respiratory secretions, so they cough or they sneeze on you, you handle a used tissue, you share drink glass, food, or towels with them, that is considered a close contact. And then staying overnight at least one night at somebody's house is considered a close contact. So these are the things that we actually are going to start messaging out to the community on things that you really want to monitor when you're considering physical distancing. Any questions on this? Okay, next slide. So the other addition, I'm really sorry about the chainsaws, if you can hear them, is called a box it in strategy. And this strategy is where we're spending a lot of our time. Now that we don't have Safer at Home, how can we control disease besides having people do the things that we just talked about? We need to test widely. We need to isolate people once they're infected. We find everyone who's been in contact with the infected people, and we contact, or we have those close contacts put in quarantine. In addition to that, what is not noted here in the test widely structure is that we're actually starting to test all close contacts. So if you go on to the next slide, one of the things that we're doing, Wisconsin and Sawyer County, is we're testing anyone with both severe or mild symptoms. So we are doing really, really good as a county on testing people with mild symptoms. Some places are not doing that. We're also starting to test close contacts to a positive case. And this graph here shows how other countries have done testing. And as you get more tests available, you can add more tests. And that would be based on the number of positive cases you have in your community. So one of the things that we're also doing is in the green there, it says add people at random. And I'm considering all of the pre-op testing that we're doing in our county as random tests. And we are finding some people that are asymptomatic through that testing process. So it is a good way to identify and find cases in our community. Next slide. This is a great slide because what we're trying to do, and we hear this on the latest data and research that is coming out, is the countries and the areas that are doing really well at being able to hold COVID at a standstill and not have a high rise in cases are those that do testing and keep their positivity rate at less than 3%. So what positivity rate means is that of all the cases that we've tested, that less than 3% of those people are positive. And that allows us to know we're getting a good screening over our population to find those cases. So in April, we were testing only very symptomatic cases. So they had to have shortness of breath, cough, sore throat, and a high fever. Our goal was to conserve supplies at that time, and our positivity rate was 1.35%. In May, we expanded those tests and we added GI, loss of taste, smell, headache, chills, body aches, and nasal congestion. We added that before the state added that. We worked together with the healthcare system and public health and came up with those criteria. That's the criteria that the state has landed on and stayed at for quite a while. So in May, we also did mass testing with LCO and with Sawyer County. We did 930 tests, and of those, we had a 0.54% positivity rate. So we're really, really doing well on our testing, and we see that across the state as well, that our county is one of the top testers. And then in June, we were at 0.63%. June, we did not have any mass testing, but we did test all SNFs, the assisted living with Waters Edge, Hayward Health Services, and all the residents and staff. And that's when we started pre-op testing as well. So our testing strategy has been very successful. Any questions on this? Move next slide.
Yes,
then.
yes.
Oh,
hang on,
yes.
hang on.
Okay.
Tweet.
Julia, is there any budget impact with all this extra testing, or are we getting enough funding from the state to cover this?
We are getting funded very well for this. Between LCO, the tribal money and the county money, we should have plenty of money, at least at our level, to be able to do the testing. A lot of this testing was free when we brought in the wing testing with National Guard, and LCO got funding for free testing. And then people are getting tested at our curbside testing, so their insurance is covering them, and or it's been covered through the hospital because they've gotten some extra funding. So the testing itself has been covered. What makes it difficult is the case contact tracing that needs to happen, because even on the negative cases, there's a lot of work that goes into those. But well into this, not too long ago, we got all our funding in place, so we can back bill into that funding, and we will be covered fully.
Great.
Okay, anything else? Then we'll quick go on to the next one. I don't want to take up too much time here. What's made us successful in our strategy is that we have one screening hotline for our county. We have curbside testing where we can schedule through the hotline, or there can be direct scheduling from the clinics, and that includes LCO. We have healthcare providers and public health. We all work together on screening guidance, and we have shared understanding of what we're testing for in our community. The hospitals and clinics have been nimble in changing their lab usage based on turnaround time. So that's a little technical. I'll kind of explain that. In the beginning, when we were testing, our lab turnaround time, or the time it took us to get results, was sometimes up to 14 days. 7 days was probably the average. Now we're averaging 2 days. So what the hospital and clinics did was work together to make sure that we were using labs that could get us our results quickly, and that allowed us to be able to isolate and quarantine as needed. So that helped keep us under control early on. The other thing is the LCO and the county have a unified command structure, and we have provided mass testing events both through the county and through LCO. And we have unified messaging with media and social media. So next slide. And this one is the final slide. Where we're at currently and looking into the future is COVID-19 test strategy. So as you can see, we have a pretty good test strategy, but as we move forward, there are things that we need to be looking at. So when schools start, what's going to happen when kids are sick at school? How do we maintain our structure over the long haul? And if our numbers rise a lot, how do we stand up mass testing clinics very quickly? So I am actually sitting on the state testing team, and there's also a subject matter expert on the team for the State Emergency Operations Center. And then we're providing the state with an initial plan of what we've been doing and where we think we need to go by July 15th. And then we have an updated plan that's due by September 1st. We received $30,000 to be able to make sure that we have a really good testing strategy. Not sure that we're even going to use all of that money, depending on what our needs are as we move forward. But we have that until the end of the year. We also are working on mass vaccination planning. So we're kind of splitting our team into who's focusing on what. So Julie is working on mass vaccination planning. And that's where we prioritize who's going to get the vaccine first, because we're not going to have enough for everyone. So we have to have prioritization, and we have to have a plan on how everyone's going to get vaccinated when the vaccine is available. We are focusing on contact tracing. With the money that we're getting specifically for contact tracing, the goal is to contact cases within 24 hours who are positive, make sure they're isolating and find out who their close contacts are and reach those close contacts within the next 24 hours. So our goal is isolation, quarantine, and getting testing of those close contacts. So we have a great team in place. We'll probably need to expand that if our cases go up. At this time, we've just been hanging on here with seeing that we've had 5 new cases in the last 2 weeks. And then my other big thing is schools opening, sports, and events. That's kind of where I'm prioritizing my time. And then there are quite a few public health questions and concerns that are coming in through multiple phone calls and emails, which the public health nurses and the sanitarians are managing on top of their typical roles. In a nutshell, I tried to do that really quickly. I know I gave you a lot of information. Do you have any questions?
Yes. Ms. Pat?
Has there been any information yet on what's happening with school in the fall?
Actually, I'm just, Winter met last week. I need to meet with Jessica at LCO, and I'm meeting with Hayward this week. Basically, there's multiple strategies that they can put into place. I think what we're hearing from families is that they would like their kids to be in school as much as possible. And then I just received information yesterday afternoon and tried to skim through as much of it as I could today. And it's really trying to focus on getting kids back into school and managing any outbreaks that happen, but also giving parents the option of having virtual school available for those that might be a little bit more vulnerable and or have family members that are vulnerable.
Thank you.
Anybody else have any questions? Tweet?
Julia, what do you feel is the biggest deterrent to spreading this disease? Is it not traveling, or is it like, you talk about bars and that with young people, but with our kids returning to school and
we're really looking at cohorting and keeping our close contacts as minimal as possible. It's those big events, connecting with people that we don't know, going to places that we're just kind of socializing as we normally would, and being exposed to people that were positive. So they're really looking at the younger kids as being less of an issue than the 18 to 29-year-olds right now. The problem is data keeps changing all of the time. So at this point, that's what we know. Things might change as soon as school opens up and we realize what's happening. But one of the things we're going to message very strongly to parents is that, you know, there could be a 2-week where we need to close down school very quickly and get it under control so we can open back up again. So that needs to be part of our whole planning. And then the other thing, and that's the testing strategy piece, I'm very much advocating, and we'll try to figure out how we can test students before they leave school so we can get those test results very quickly. So if they came in, they were fine or potentially weren't so fine, they have potential symptoms, we want to be able to test them quickly, get them home, isolate, get those results back quickly, and either bring them back into school and or isolate and quarantine.
I have a question.
Yes, Dawn.
Today, there was some information released that, the airborne is absolutely airborne, transmission, who is not acknowledging, and the 239 scientists have written a letter to our government, international government, and WHO to acknowledge, plan and prepare for, because it is airborne transmission. They keep saying that it's the large droplets and it's 6 feet, but it's actually the small droplets. It goes, we need farther as at 12 feet. And it is not just for the hospital settings, because that's what WHO is saying. It's just for the hospital settings. And they're finding that it is most definitely airborne transmission, and you do not need to be coughing or sneezing. It's just us breathing. And is there going to be, are we going to prepare for it? Are we going to plan? Is there going to be anything in the works for it? Because,
Go ahead.
you know, that is what it's going to come down to, is that they're finding there is no herd immunity. And if the kids go back to school, it is just going to be one cluster after another with them getting ill. And mask, the best thing you can do is everybody needs to mask up. It shouldn't be if, it's you have to. That's all. That's what, you know, is coming out. And EPA approved today for Lysol as a disinfectant to combat COVID. And that was the other thing. I'm actually the COVID coordinator over at the LCO College. So I will be contacting you, Julia. Because this is what we, you know, we're trying to figure it out, because they're finding out it's just not the large droplets, the small droplets also.
That just came up on our call today, and some questions through that with the subject matter experts. And so
Yeah.
that's going to be brought to the attention of the physicians to look at that a little bit further, and that data. It's being validated at this time. So we can
Okay.
talk more about that next time. The other thing is we are looking at ventilation systems as we go through as well. And making sure, hopefully, that we can put some UV systems in, or some other systems that make sure we have good, clean air exchange. We'll never have negative pressure. We're never going to have what they have in the hospital,
Right.
to make it so that it's 100% safe. But we do, the goal is to try to continue to allow people to have a life and not be
Right.
having those other public health issues that come with depression, suicide, alcohol, all those other things. So we're trying to find that happy medium as we move forward. So,
Okay.
but it's all important. It's just, you know, which risk factor are we considering biggest problem at the time?
Okay. Thanks.
You're welcome. Anybody else?
Yeah, Julia, I've got a couple, 3 questions here, just quick ones. Some people have been questioning me. It seems the shorter the return on a test, the more they think it's likely not to be real accurate. Is there anything to that? What can I say to people who think that?
No, actually, some of even the shortest test return times that are 1 to 2 hours actually are showing in the high 80s of a rate of specificity, which means accuracy. So there are only a couple of tests out there right now that they don't think are that accurate, and those tests actually get a second qualifying test at another lab just to validate that that is correct. So so the tests overall right now, whether it's done from the nasopharyngeal, which means that Q-tip is stuck way, way up, or whether it's just that nasal swab where they turn it around in your nostril, they are all in mid to high 80s in the specificity or accuracy rate, which is extremely good for a lab test. All lab tests, there are many lab tests that don't even have that much of an accuracy rate. So very, very good.
Okay, thank you. You mentioned personal protective equipment earlier. We have enough of that stockpiled ready here?
Right now, Pat Sanchez and Matthew Rydell are doing a very good job between LCO and the county of being able to stockpile personal protective equipment, hospitals. We're working with the schools on what they need to order as well. So at this point, we are not in a difficult situation.
Okay. If other people have asked me, maybe they're over 65, over 70, and they just kind of would like to get tested, where do they go?
So at this point, the testing is going to be for symptomatic testing, but we will have some sites that open up for mass clinic testing occasionally that will have asymptomatic testing. If people feel like they've been in contact with somebody who could be positive or they have concerns with that, they could reach out to their healthcare provider. They may be able to get them a test. But if you're just doing one random testing between LCO and the county, we will be having some larger mass testing sites over the next couple months.
Thank you very much. That was going to be my next question. So I'm done with your questions. This has been very helpful to us. Does anybody have?
You sparked another one.
Tweed has.
Julie, I just got one last question. You know that we've reopened our casino now and we kind of limit the amount of people that can come in and we social distance the machines and the chairs. And we have yet to open our buffet. I guess we were looking for advice from you as our public health officer. Is that an area where it's more likely to be spread in a buffet type setting?
Yeah, any self-service or buffet, we are still recommending that you don't do that. Even if you're having like a party at your house, if you can have people serve up or one person serve up food, just to kind of keep it so you're not handling it. And, you know, the thing that you would have a hard time controlling, but you could potentially do, is have a hand sanitizer unit right in front of the buffet and keep monitoring that everybody fully hand sanitizes their hands before they go through. I mean, there are some things that we can potentially do, but it is more of a high risk situation.
Anybody else have any further questions or comments? Okay, thank you very much, Julia.
Thank you. You guys all have a great evening.
You too.
You too.
Okay, now we're on number 9, fiscal 2021 Health and Human Services budget. We're just going to talk about that.
Well, introduce the topic. Where we're at with the county budget, obviously, we're in the preliminary stages. We've asked departments to prepare their budgets, their departmental budgets, and you'll be looking at the Health and Human Service Department budget tonight. So this is one of the first ones and that we've seen. The rest of them will roll in through July here, and then we put them all together and see where we're at with the entire county budget, and then make changes as needed after we get everything rolled up. So this first look at the Health and Human Service budget, you'll get a lot of information here, and Patty and Paul will kind of walk through all the various programs and activities and services that they provide as a department. This is obviously one of the most difficult departments to understand all of the services that are provided, because they do so many things for the community and for the people of Sawyer County. So yeah, it is difficult, but there's a lot of information there, and it's up to us to kind of put that in front of you and make you as expert as we can in the topic. So we'll also talk a little bit about the format of the information that you get. There's been some chatter about what kind of information the board wants. So Patty will also kind of go over some alternatives as far as reporting goes, to see if we can get something in front of you that is easier for you to comprehend all of the things we're trying to get across here. So we'll start out with that, and Paul and Patty, if you want to take the floor. Always did.
I've got a couple paper copies, Jim. Dale, do you guys want one? Okay. It's the same one that's on the email, right? Right, but yeah, that's big, so, okay, not a problem. So, for the sake of the brand new board members, I'm just gonna go over a little background in the budget process in general. When I start preparing the budget, how we do that is, first of all, I start with, the county accountant. Mike gives me everything that he wants to give me on payroll, the costs and what he wants me to put in the budget on that. So this budget is based on the payroll costs of the end of 2020 here. 2020 is slated to have people go up in Cross and Detman steps. So I took it as of the end of the year of 2020. He did project in there an 8% increase in health insurance. So that you're aware of what this is. Okay. The first page is basically the bottom line of what we are proposing. On the left-hand side of the page, you will see the expenses. This is the whole agency rolled together. You will see that it is the 2021 total. Then the next column is expenses for 2020's budget and the difference between 2020 and 2021. And that's per line item. Then underneath the expenses, you're going to see that how much county money we are asking for, the 2020 county money request, and the difference between 20 and 21.
Okay, so the
Yes.
difference, if I go to salaries, the 2020 expense for salaries was $2,039,000,
Yep.
correct?
Yep.
And the projected 2021 total is $2,013,000.
Yep.
So we're going down there because of less positions.
You're gonna see that in a minute on the right-hand side.
Okay, so this number in parentheses means that we're under.
Yep.
Okay.
Yep.
Okay. Thank you.
So on the right-hand side, you're going to see the 2021 revenue by funding source. That's grants, medical assistance, client collections, insurance, and total. You're going to see what we projected, what we budgeted for 2020, not projected, budgeted. Then the box is the difference between that 2020 and 2021. Okay? In order to get to the bottom line here, this is kind of complicated, so I want to explain this. I take the expenses minus the revenues, minus the indirect cost, gives us the county money that we're asking for. The indirect cost is the cost for having health and human services in the county. It's the cost of TOM, payroll, maintenance, lights, etc. Health and Human Services themselves does not pay that cost. We don't cut a check to anybody, but I claim the cost in the budget because some grants are able to pull down matching funding based upon it. So I claim it into the budget, but it is not counted as an expense. Well, it's not like I'm saying, hey, give us that money that we're, So I do subtract it back out so that this is the true county request. But it allows us, many of our grants request maintenance of effort. And some of our grants, not many, but at least a couple handfuls, allow us to pull down extra funding because of it. So that's why I claim it in. On the right-hand side, you're going to see notes. These are significant changes to the 2021 budget over 2020. We're contracting out for the AOD prevention services in this budget. Right now, that is done in-house by staff, but we are having a hard time retaining staff. It's hard to get that position. We have had one of our public health nurses doing the prevention program for us at this point in time and holding the licensure. We can't continue to do that, especially with COVID. Julia can't spare the staff for it. So we're looking at taking that service and contracting it out. COVID. Julia had me project COVID activities and costs through June of 2021. So it doesn't impact this budget because I offset it with exact revenue. So, but that is in the budget. We increased, and you're going to be seeing this and why. We increased our budget for Winnebago from $175,000 to $600,000. You're going to see the difference between 20 and 21 on this budget is $762,349.29. Additional county money that we're requesting. It's because we are increasing what we're budgeting for some of our big ticket items, okay? Next, we're increasing child welfare out-of-home placement costs by $342,680. Increased foster administration from 15,000 to 50,000. We increased kinship benefit just to offset the revenue. You're gonna be seeing some things as we go through here that may be increasing, and I'll just highlight those for you that it's just because we got some more money, okay? And we increased child welfare, other funding services because we got some more, we got grants, okay? Those are just some major highlights here. Now let's go on and let's see what it is that we did. Page 2. Page 2 is the administration expenses for the agency. The next thing that I do, when I did this budget, normally, what I do is I take the first 5 months worth of expenses, divide by 5, multiply by 12. I also take into consideration any outlier things that I need to think of. Example, immunization only happens in the fall for us, flu clinics, things like that. There's other things that happen in the spring. There's things, so I may not have any expenses to that yet. I may not have any staff time there, but I have to be cognizant of those things in doing the budget. I had to throw 2020 out because we're so atypical. So I went, basically, other than doing some tweaking, in our process, we meet with each and every supervisor, we ask them what's happening in their unit, and they give me what they want in the budget, okay? Then I prepare it, we meet back as a team, and they tell me what to increase, what to how to change it, what to do. So this is that calculation. From there, we met with Tom and Mike and let them know what's on here and what they would like us to change before it comes to you. You're actually seeing what the management team, because Tom and Mike didn't have me change anything at this point in time. Administration is what it costs Health and Human Services to administer the programs. It's the costs of everything that I cannot directly put to an account. So if I'm ordering postage for child welfare, it's gonna go to child welfare. However, if I'm paying for postage for the agency, that's what's under administration, okay? It's also the staffing costs for anybody that answers the phone, your director, your payroll costs, things like that, your internal costs. This is here just to show you the bottom line and what's on it. This then gets divided out by full-time equivalency staff to each and every unit. This budget is broken up by units by the supervisors, basically. So as we go on, you're gonna see this administration amount is broken up and it's at the bottom of each and every budget. Next, long-term care ADRC. This is the unit that Lori Perlich oversees. You're going to see again by budget line item all the way down. You're going to see how much county allocation there is, what our 2020 is, and the revenues and any difference in revenue. The only thing that really significantly changed for per unit was that we lost the Alzheimer's grant that went over to the Senior Resource Center to administer. So you are going to see that that is a reduction in revenue. Why are we down in county allocation so much? Because the more grants that I have, the more that the staff time is split out, the less that is hitting each and every unit. So the less that each unit has to pay. Also, if you, on page 1, when we have indirect costs are calculated by a company that the county hires called Sequoia. They give me those figures and it's based on 2 years previous. So when I did the budget for 2020, the indirect costs were $555,000. When it came back in for 2020 actuality, it was only $396,000. So I am budgeting for 2021 what we're paying in 2020. So that was a huge reduction also. So you're seeing that all reflected of why. Long-term care, other than that, had no other changes to their unit from the previous year. Page 4, what you're seeing here is what you're going to be seeing for each and every unit. The purchase service is the largest expense category in each and every budget. So what I've done is I take the items, these go back all the way to 2011 and give you history. So all the way back to 2011, it's what the actual, it came up to be at the end of the year. From 2011 to 2019, projected costs for 2020, what the 2020 budget was, is, and what we're planning for 2021. The only thing that changed under the long-term care was we took out the $5,294 for the Alzheimer's support because we don't have it. So that's the only thing that changed on this page. This was a pretty easy one. Next, AODA mental health. Joe Bodo and Alicia Carlson oversee the components that are in this. You're going to be seeing an increase. The county allocation we're asking for is $1,232,000. In 2020 was $896,000. We have a reduction in revenue that is based upon the fact that we got rid of a counselor also though. Okay, so let's turn the page what you really want to look at. Your page 6, your purchase services for AODA mental health, that's alcohol and other drug abuse, mental health. You are seeing under mental health and AODA all the way down back from 2011 through 2019, the actual costs it costs to have, you know, for the service. What we're projecting for 2020, the 2020 budget, and again, what we are putting in the budget for 2021. The very first line item you will see, we are looking at our projected 2020 for Winnebago is $1,393,000. I'm rounding here. We've only budgeted $175,000. We're putting $600,000 in the budget for 2021. In meeting with Tom and Mike, this is a moderate budget. We put this in here because 175 is way out of line. 600 is not realistic either, but I don't know what you want us to put in there. So your input is greatly appreciated. I can tell you that right now we have 2 people living in Winnebago. They have one-on-one service with somebody watching them and staring at them 24 hours a day for both of them. One of the people, Joe, thinks he is going to try to get into a residential service. But if you notice down, we did not increase our residential service costs. So $600,000 is about enough for one person in Winnebago. So again, it was a figure that was agreed upon. That's what we left. Northland Counseling stayed the same. The next, if you go down the line, the next thing that changed to the previous year is CCS. That's the $10,000 that we talked about for the administration fee. Next, CLTS, it went from 63 to 81. That doesn't impact the budget at all. We got additional revenue on that.
Which one's CL?
CLTS,
About halfway
right
down.
underneath the CCS. The CCS is 10,000, then it's the next one down. Then you're going to go down to transitions under AODA. It's the third one down under the AODA column. Our Northland Counseling is who we contract with to supply the staff at transitions. Carol Lund cannot find anybody to work there. And she has been offsetting the costs out of her own pocket and running in the red for that program. We don't want to lose her by running that program. It is offset. We have some significantly expensive people there over the years, and I guess Joe can speak to this at this time or whatever, but we don't want to lose the program by not having the staff. The increase here is to give her, to pay for what she's given them for their bonuses, perks, increase their salary, whatever it is that she has done to try to keep her staff there and to attract new staff. So that's what that increase is for. Prevention, again, it went from 7,000 to 17. That is because of contracting that out. So that is why you're seeing the increase here. The next page, page 7, is children and family. Carla is the supervisor under children and family. You are seeing an increase in revenue of $61,000. We did get additional programming. You are also seeing a significant increase in expenses and purchase service. So the next page, page 8, goes on to that. You will see the third round, RCC. That's a residential caring center. When you place a child in out-of-home placement, the first place they go is, or the lowest form is kinship. Kinship is when they're with a relative, and that's a state set rate to be with a relative. Next, it's foster care. Next, it's therapeutic foster care. Next, it's group home, and the highest level is RCC. We currently have 5 kids in RCCs. We are projecting to spend $731,000 there. And Carl is not anticipating that any of them are going home anytime soon. Did you want to speak to that?
Yeah, I don't know if the tribe could talk to the state or, but it's all trending that all those RCCs are native youth placements. And you guys can speak to the state about getting some kind of help. I don't know if there's any more than what we're doing, but those are all those placements that are coming in. And of course, the tribe can place them wherever they want. But I think all 5 of those are native, right? So.
All the RCCs, group homes, and therapeutic foster homes are there. And I know Carla's working really closely with this.
It's a business to see if we can, what we
Right.
can do.
I know they work well together.
Yeah.
Does that have anything to do with the 161 agreement?
No, not really. That's just how they're. No
Placement, yeah.
Right.
May I interrupt and go back to when we talked about Winnebago and Mendota? And you said that the cost for one individual is going to be the 600,000, and we've got 2 there. So isn't that $600,000 increase unrealistic?
Yeah.
So isn't this the time to address that?
But, we really don't. I mean, I can't guarantee what it's gonna be. Again, My best guess is that you'd leave Winnebago at 600,000 and you tell me to add some in for residential is what I would guess here,
Okay.
okay? I can tell you that one of the individuals was receiving Medicare and we would get some payments offset of it. The individual has already met their lifetime maximum for Medicare payments for mental health. And they're what, 20, 21?
He's, sorry, 22, going on 23.
Oh, okay. Already lifetime, so,
And these individuals have been there for a few years, and it's probably not expecting any change there as far as them coming out into community.
Well, I could speak to that briefly if you'd like to hear.
Okay, I would.
I think, they're, certainly they can come out in the community and we can try them in the community. But like anything else, you have to have the tools to get the job done. And to bring them in the community or get them out in the community, we need the tools. Right now, currently, our highest cost placement in Winnebago, who's been there for a long time, is in the hospital for swallowing, being on a hunger strike for 4 days, 5 days, and swallowing a chapstick that they want removed, and she doesn't want to let them remove it. They have contacted us to get a guardianship going on her and get her a guardian because she can't make these right decisions. Because the division in our department that handles the guardians are under such concern not to spend money to pay for the guardianships, where I heard we only did 3 this year, as opposed to past years. This is becoming a very cumbersome process when it should be an easy beans. The reason I address this is because when we used to do guardianships before, and we were the guardians, we had a little more control over placements. So this very same person, when she was in our halfway house, and I was managing her here, but she ended up putting things around her neck and swallowing glass, so I took the glass away from her and took what she was doing that and took it away. The state came in and fined us $10,000, but then they reduced it to $6,400. But when I was guardian for the other person that was there and they would do those things, guess what? The guardian makes all the choices. So I'm in a good spot now to try to get a guardianship to maybe manage this person more effectively and try to get her out. Maybe she fails, maybe she doesn't. But you can say, hey, if she's going to be doing this, then you make her sleep under staff supervision, which is a violation of their rights. But if you're the guardian, you can make that determination.
Very good.
But because we've gotten each department here so paralyzed with watching every penny they're spending that you can't even work amongst each other to make something happen. I would like to try to move both of those people out this year. And if they fail, they fail. But I think it could be made, it could happen. And if it meant that person comes back to transitions and we have to hire a whole nother staff person, now Carol can't get people that are master's levels or bachelor degree, but there's plenty of people through these college programs and whatever that could be around just to watch somebody all the time. You can say if you see them doing something or they start, call us right away. We could put that money into something like that, have a staff member one-on-one with each person and save $1 million. But when it comes time to do the job, you got to have the tools. And this system, as it's working within this county right now, is even prohibiting that. I'm frustrated right now that I can't get a guardianship filed when Winnebago is saying this person needs a guardian. And it's because the process, because guess what? Sawyer County gets stuck with the bill if they're a guardian. In the old days, I used to be able to tell Peter, talk to somebody, say, this person needs a guardian. If it costs us $5 or $7 grand to do it, we were way ahead when we moved them out of a joint like that. So I'm just frustrated. You gotta have the tools to do the job.
That's common sense.
Okay, go ahead, Patty.
This is the same person that,
That's
by the
okay.
way, swallowed a marker cap a while back that perforated her esophagus and went into her chest cavity above her lung. And she said she wasn't going to let them operate on it, and then she finally did. This person clearly needs a guardian, however it can happen. And that would make it easier for me to place at some point. More protection, that's all I'm saying.
Go ahead.
Oh, Mr. Chairman, I just had like to ask, what is the process of getting a guardian? What department and it's a little money now that saves a ton of money later, how can we address that?
Can we get through the budget and then address it?
All right, we're on page 8. So that was RCCs. RCCs, we are projecting 731,563 for 2020. We had budgeted 320. We're increasing that to 650 in 2021. The next, foster administration is the next major. You're seeing kinship benefit increase, but that's offset in revenue. We got additional revenue. Foster administration, again, though, it's foster care then therapeutic foster care. Foster administration is the cost to pay the company to use their therapeutic foster home. And we now have 5 children right now in therapeutic foster care. And that runs anywhere from $2,200 to $2,400 a month per child. So 50,000 is very conservative. Other family services, we had budgeted 25,000. We increased that to 28. That's due to additional revenue that we did receive. The next major thing you're going to see is down TSSF. It's the 19,970 in the 21 budget. That was an additional program that we got revenue for that is anticipated to, we got it this year unexpectedly after the budget was done, and it is looking like it's going to increase. One thing else that I do want to point out to you is on the right-hand side, you're going to see all in JJ budget. That Oasis Group Home, we are projecting out of child welfare to spend $154,559. Years ago, we're still on page 8. All in JJ, it says on the right-hand side.
Oasis.
Years ago, I had split the budget for the Oasis Group Home between children and family and juvenile justice or youth justice. I was told to put it all in one so that it was easier to see how much it was costing us for Oasis. I did that. So this is just showing you that the cost is in child welfare, but the budget for it is in youth justice. Just want to bring that up. Juvenile justice or youth justice, again, you're seeing a decrease in county allocation. There were no changes to this, no significant changes. The purchase service is exactly the same. Again, there's no changes to this budget. Economic support, there were no changes at all. Page 12 is the purchase service for economic support. Again, no changes. Public health. Here you have some significant changes. We did have Title 10 was a program that we had that was supposed to end. It overlapped with the PrEP grant that we got. And which is under here as positive youth development to try to keep the names different a little bit here. But Julia did receive notice that that funding will continue for 2021, so that was a big unexpected windfall, as well as COVID funding in here. So you are seeing an increase in revenue, and you're seeing a nice decrease in county money based upon those additional revenues that it's bringing in. The purchase services for public health remain unchanged. The sanitarian and water testing programs, this reflects a 15% increase in revenue that was passed by the board. So this is taking into consideration that increase in revenue. And the purchase services did increase a bit. The increasing of the water testing in Oshkosh and host compliance, what that is it's a, where they pay to have someone look at the vacation rental by owner and see who's out there and who should be having licenses and review all that so that they can contact them and ask them if they want to become licensed and have their water testing. So all those pages combined roll up to that top page again and give you a snapshot of where we're at. If you look again, your notes on the right, between the increased costs that we put in for Winnebago, the increased costs for out-of-home placement, and the increased foster care admin, that's more than what we're asking for the additional county money. And even if we do have a blessing, Joe, though, that you're able to bring people home from Winnebago, our residential costs would have to go up. Because right now we aren't, at this point in time, I'm just going back to page 6, and residential care, we are only budgeting $250,000 for that. So they would still be expensive people to bring back into the residence. So I'm not anticipating, and I kept that the same. COVID, and when we're looking at I'm looking at 2019. We spent $212,300 in residential placements. We budgeted $250. 2020 is such an outlier year for a lot of things that, you know, there were placements that we couldn't make because no one was accepting them and there was nowhere to put people. There's placements that we couldn't bring home because you can't move people when COVID was active there for months. So we took all of that into consideration when we were having our meetings with each and every supervisor. Any questions?
Any questions?
Any questions you got?
Tweet.
Tom, how much money are we getting from the state or allocated for CARES money for expense, COVID-related expenses?
Well, there's several pots of money. Health and Human Services has their own unique pots that were allocated. General Fund has some other money. So we're meeting with Julia and Mike Keefe, Patty, to make sure that we capture all of the expenses and find the best place to allocate those expenses to. Like FEMA, you know, doesn't reimburse 100%. Can we use another pot of money first? All those kinds of things. So the total, I don't know what the total is, but there's different pots. And there's even talk now of a fourth package coming through that may help on the revenue side for counties. That one hasn't been allocated yet. So the first allocation that we have to submit is by July 15th. So we're going to be meeting this week with that staff to coordinate that effort and submit for those reimbursements. And then there'll be another one later in the year as well.
And this is Julia, and just to let you guys know, we have been told that there will be money going into 21. We will be saving whatever dollars are can be spent in 21 for 21, but we don't know how much will be coming into 21 at this time.
Anybody else? Comments, questions?
I've got a bunch. And I shot Patty and Mike Keefe an email earlier. Basically, the reason I won't vote yes tonight on this budget is just because we received this late afternoon. We heard how difficult it is to put it together, and I have no doubt about that. I can't even imagine. I had to ask for a list of acronyms because we've been WELP and all these things mean absolutely zero to me. I asked for a list of acronyms. I can't vote on something that I have no idea what I'm doing. I mean, it would be,
Just to clarify, there's no vote on the budget tonight. This is the introduction, so.
I saw the paper for signatures, it makes no difference. And I'm not saying it's a bad budget. Hell, it might be the best budget we've ever had. And I think putting money in towards Winnebago is a huge first step. Why stick our heads in the sand and say, well, we're over by $500,000, $1 million again because we have Winnebago. Well, we know we're gonna have it. Let's put some money in it. I actually was talking to somebody from County Mutual Insurance. And I said, is that something insurable? Can we get insurance if we have excess Winnebago commits every year? And the answer is no, we cannot. But, we have to look at options. I think this is a good start, is putting some money towards it and basically self-insuring ourselves. And let's hope somebody comes home or something happens and we don't have those expenses. We can bankroll some money and have it for years to come. Putting our heads in the sand just isn't gonna do it. I asked Patty to come up with an easier read, which is what we got today in our emails here. The 35 pages before that were valueless to me.
Okay.
This is much easier.
That's on C though, that's the budget performance report.
What's on C?
That, what you're talking about is item C, the budget performance report
What we just went over
is
here
the budget, that's number A.
is budget, but, we got the performance report first, because I didn't have this until today.
The front page was in there.
That was it,
I-
yes.
When we met with Tom and Mike, we decided to give you all of it. We were trying to keep it easy on the budget. And then I actually thought that doesn't make it easier because I think the most valuable information on the budget is how much we spent from 2011 to 2019, to see the history and to see where have we spent? What's it costing us and where do we come up with our rationale and are we out of our mind? Because I'm the one that argued to give you more on that. The budget, when we first sent it out, was only page 1. And I actually asked, can I send you the rest of this? Because I don't think page 1 necessarily makes enough sense without the data behind it. Without you guys seeing those foster care rates, like the RCC, that in 2017, we spent 330, we spent 489 in 18, 489 in 19, and we're budgeting 320. At some point in time, we've got to pay the piper. So that history is what I was hoping would be valuable, actually.
And that is valuable. And I asked one question, it wasn't poking, it wasn't prodding, it wasn't anything else. I asked Mike in my email, the victim impact panel. People come in, they pay $75, they sit through a class, hopefully they glean something out of it, better myself, you leave. I said, where would that fit into the revenues of this budget? Where's that line item? And I didn't receive anything back. So I still don't know that question. And it isn't that particular fund. It's, this thing is so monstrous. It's $7.5 million. It's bigger than highway and sheriff's department combined. This is one that people are expecting the county to have the reins on. I mean, it's a lot of money. And I think staff has done a great job and you understand it. I don't. If there was a vote, again, since I don't understand it, I couldn't vote for it. But hopefully in the years to come, I will move along and try to understand it better. I did have one other question about that Oasis. There was something in there that struck me odd about Oasis in the budget review.
Okay.
It was Fund 258.
Page 10 is the purchase services. Page 9 is their budget. So you're probably looking at page 10.
didn't write down a good enough question for myself, so.
Do you want to use my paper copy?
No, I can see it. I just don't remember. I wrote it down on a note. I
Okay.
left it home.
Maybe some background on that. Oasis. We bought the property. We had to pay to have city water and sewer put into it in order for it to be used as a group home.
Right.
In 2021, so we have a sewer assessment that we had to pay for 10 years. That's in there. We also contract with Northwest Passage to run it and to staff it. So basically, they run the program, they do everything. In order to get them basically to come to town and do that, we have to guarantee them a certain number of bed days. So we have to the 192.10, the state every year tells us, this is what you're paying group homes and RCCs, and they tell us what we're paying. We don't have a choice in the matter. It's not like we can negotiate that, you know, Patty's a worse person than Paul, so you have to pay more for her. Nope, they come in and tell us the bed rate, okay? So we have to pay, we've guaranteed them 6 bed dates out of the 8 per month. Now they try to get kids from other counties in, so then that goes off and we don't have to pay those. So that's what that offset bed charge to other counties is. So we have to pay them $420,699. That's what we've guaranteed Northwest Passage. We are saying that we are going to collect from other counties putting their kids there. It's not that we're collecting, they won't charge us that if other counties have filled some of those 6 beds. So Dave is telling me that he believes that we're gonna get $150,000 with other counties putting kids in Oasis. That's what that is. So the net for our cost for Oasis is $276.99. Does that make it understandable?
Yes. Does that answer your question?
Well, somewhat, just, you know, it's tripled, quadrupled. And
Well, I think because of the children and families placements there.
Right.
He's looking at projected for 2020 is 77,000. Is that what you're looking at, Dale?
No, maybe we're on a different page. Are we on page 10?
Yeah, we're on page 10. What's quadruple?
Well, the projected in 2020 is 72,000 and we're going up to 270.
Okay, remember that I said under the children and family that they had 150-some thousand in their budget? That's being spent out of there, but Oasis is all in the juvenile justice budget so that it's not confusing. You guys know how much Oasis is costing? Remember, am I saying that?
I do, but
Okay.
I'm not.
So under children and family, we're projecting that it's gonna cost us $154,559 for 2021,
As opposed to,
plus the 72. And then at this point in time, that's what we're projecting.
Maybe it would help to understand there's 3 different target groups of kids that could be placed at Oasis. There's abuse and neglect and children and families, which falls under child welfare. And then there's delinquent and status offenders, which is your juvenile justice.
so are you telling me that the reason it's $270,000 now, instead of the $70,000, is because it's getting moved from a different line item and moving there?
Yes,
So there's $200,000 in a different line item that's going away.
That was on page 8.
yeah.
Page
You
8.
have 154,000.
We're projecting let's just round it, $155,000 out of children and family. And we're projecting at this point in time, 72 for 2020 out of juvenile justice. Again, 2020 we've guaranteed Northwest Passage those figures up on the right. We've guaranteed them that. So the more that they can bring in kids from other counties, the better off we are, bottom line. Do you want to show them on your paper?
So Dale, this, under the children and families, is 155,000. The expense is within children and families, but the whole budget for Oasis is in juvenile justice. So you'll see here, we have this expense, but there's no budget to it. The budget is actually in juvenile justice, that 270,000. But your actual expenses are this 155 plus, what was it,
72.
72,535.
Those are the projected
So
expenses
when I
right
asked
now.
you, $200,000 is moving from one line item, which is here, to another one, that's what it is.
Yes, correct.
Good, all right,
Okay.
there we go.
And the only reason for that is because years ago, everybody wanted Oasis on one budget because it was too difficult to have it in child welfare and juvenile justice to know, okay, what's Oasis costing us?
Sure.
So they wanted me to put it all in one budget. That's why it's like that.
Okay. Does anybody else have any concerns?
What is Oasis costing us? I mean, when David gives the report other years, he would say how much we're saving by not placing these kids out of county in different facilities, right?
Right.
So the money we save by having our own Oasis, how does that compare to what we're spending at Oasis? Or what Oasis costs us?
That,
Can you put that in perspective for us?
my best thing is that bottom line, worst case scenario, Oasis is costing you about $50,000 a year. That's the worst case. I mean, that's like this year. That's how much you're having to pay them for empty bed days this year. That's what the projection is on that. But this is a COVID year.
Right.
I mean, and we haven't had to pay that in the past. That's also, I'm talking as a bean counter here. I am not talking as a social worker of how much it means to have little Cindy next to me so that I can go visit her and bring her home to my family faster. I don't have a clue what that, you also have, because we have that facility there. Part of it is rented out to the day treatment on the other side, the Northwest Passage day treatment, okay? So they pay rent on that, we make $1,200 a month. The group home, and the day treatment center pay all of the utilities and all of the costs on the bill. So it's not so simple as to say, let's just get rid of it and let's close it down, because if you were to close the building down, okay, I don't know that you're gonna want, the day treatment's gonna wanna stay there without the group home attached to it. I don't know that, I don't know anything about it really. But if they didn't, you're losing $1,200 a month in revenue. And it's a metal building, you can't not heat it and have it taken care of, which then all becomes a county cost. So probably between all of that is gonna be close to what you'll be spending this year. Do I think that we're making out like fat rats by placing kids there over the high cost RCCs that they would have been to? No, not really. I mean, I'm not, I don't know the children, but I'm not convinced that every one of them was RCCable. But I also don't think it's costing us that much to have it there. That's my opinion, totally. And you're talking about a very unusual year here. We two whammies here, okay? The 2020 budget was the first year that we increased the guaranteed bed rate days. From last year, in 2019, we guaranteed 5 bed days. We didn't have a problem making that. We didn't have to pay them out of pocket for empty bed days last year, or the year before, the year before, the year before. They came and negotiated to be paid 6 bed days. Now, every month, we're paying them empty bed days. But it's a COVID year. So are we going to have to pay that in 2021? I don't, so it's a hard, it wasn't a problem before. Let's put it that way.
Okay, Judy, anything else?
I guess, if I can go for anybody else, the AOD mental health budget, maybe, so we could tell, your increased, well, what, almost 300,000, right? Is that, are we gonna maintain the services that we currently offer with this increase? Because I know there's a concern amongst a lot of county board supervisors. Are we gonna have to cut services, especially in mental health, AOD, or are we gonna maintain the status quo, continue what we have?
We're planning on continuing what we have. Actually, we're planning on CCS. It's gonna take off.
Are we filling the positions that are open, or are there still a bunch of open positions?
Right now, we have mostly clerical positions that are open and empty right now. We should have, I believe that there's still a CCS position, I can tell you, I've got my budget supporting documents right here.
Okay, excuse me, we're kind of getting off track here. Let's get back specifically to this budget and what we've seen here tonight. Tom, do you have some comments?
Yeah, we can entertain other questions as we go along here, but I just wanted to summarize what Patty has presented here. Going back to page 1, the difference in county money. And what do we mean by county money? That's the amount of tax levy that's required to pay for these services. They do get other revenues and grants and state aid and other revenues that come in, but the amount of county levy or taxes that are required to fund this budget, with the budget the way it is now, increases $762,000. That in itself is not sustainable. That, each year, as we talk about levy limits, especially at the county level, we get about $70,000 countywide increase each year. That's the amount of money that we have to increase the entire budget, not just this budget. So when we come in at $762,000, obviously that's not doable. So what do we do between here and there? A lot of this is driven by, those placement costs, Winnebago, and, the dollars there. As Patty mentioned, that's most of the increase. Otherwise, all the other programs, if you just look at those, are pretty equal. I mean, we could sustain the services that we do if we deal with the $762,000. So what's driving that? Again, it's those placement costs. Where did we come from? We originally didn't budget at all for those. And then we started budgeting as much as we could. We got up to about $175,000 budgeted, which obviously is not enough. But as you look at the overall budget in Health and Human Services, if you've got revenues and you've got expenses and your revenues are higher than your expenses, you end up with fund balance. And if that fund balance goes up, that means you've got more revenue than expenses. Over the last 5 years, our fund balance in Health and Human Services has increased, which means even though we're under budgeted in those areas, we're still able to meet the budget because of open positions or efficiencies or other things that happen within the budget. I mean, you hopefully aren't to the penny on all of your budget items. So more by luck than anything, we've been able to keep going, even though we're not budgeted to the full extent in those areas. Is that a good way to do it? Maybe it is, maybe it isn't. The alternative is, if you want to be totally realistic with that line item, it should be probably double what it is. So, if you're $1.5 million over what you did last year, what does that mean? That means we're going to have to cut $1.5 million out of this budget or the county budget if those line items are going to be budgeted to that expense. So, I mean, that's an option, and this is an option. So, in the past, what we've tried to do is be realistic to the extent of still providing the services, not laying off staff on the probability that we may have to pay Winnebago costs and still maintain the budget. there's some risk to that. There's also some risk in reducing services and not providing some of the other things that we provided. But that's certainly one of the things that this board needs to look at, is the level of services that we're providing in all the areas that we've talked about, the proper level of services that you want to fund. And how do we address the $762,000? Now, the reason there's no action taken tonight is because this gets compiled with the rest of the departments. We've got 20 other departments that we get budgeted for. Some may be over, some may be under. We put that in the big bucket and say, okay, here's the problem. It's not just 762,000, it's all this other stuff. And then we need to close that gap in order to meet our levy limits. So, tonight I think was a good introduction on the things that we need to think about. We heard some good questions here, and you can take these home and study these and ask questions again next month. But then next month, we kind of really need to hone in on what this department is going to be providing for services and where this budget is in comparison with the other budgets. So, if there's any other questions, I can entertain those. Otherwise, that's kind of where we wanted to get to tonight with this.
Okay, let's move.
Lori Perla, kind of hand up for a while.
Please, somebody tell me this.
I did. We were rolling through the budget, so.
All right.
Yeah.
Go ahead, Lori.
So no disrespect to my colleague, but I want to clarify some information that I don't believe is true regarding Adult Protective Services and the guardianship. Adult Protective Services do not base their decisions upon the cost to the county. Adult Protective Services has a very difficult decision when it comes to guardianship. We are tasked with weighing the rights of an adult to make his or her own decisions and their ability to competently make those decisions. So we have to weigh their rights against the risks and whether or not they are willing to take the risks and that they have an understanding of the risks. In this situation, as it stands, we are investigating the case further. We do not at this point have any indication regarding the level of competency that this individual has. And for anyone who is familiar with the guardianship process, that's what it comes down to. Is the person incompetent? Guardianship is also the most restrictive form of decision-making. When we present to the court regarding a guardianship, we have to demonstrate that less restrictive measures such as powers of attorney, working with the individual, having counseling, whether or not those less restrictive measures have been tried, and if so, why they failed, and if they haven't been tried, why have they not been tried? Guardianship is also not a panacea that a person, guardianship takes a person's rights away, but it does not give the guardian unfettered rights to make decisions about a person's treatment. There are very strict legislations, even once a guardian is in place, regarding what kinds of treatment a guardian can consent to. And even when a person has a guardian, the person's desires, wants, expressions, provided they have made them prior to being found incompetent, also must be considered. So if a person, for example, is not consenting to cancer treatment, we don't rush in and say, well, you have to have a guardian because your family thinks you have to have this cancer treatment. If you have the ability to weigh the risks and say, I'm not willing to go down that path, then adults have that right to make decisions about how they live their lives. So while it may be efficient, while maybe having a guardian might make it easier to move a person from place to place, that person's wishes also have to be considered, even in placing them in a treatment facility. So, you know, I can't speak to what was done in the past. Programs change, rules change. Maybe in the past, the county found ways to work around this, but the goal of Adult Protective Services is to protect a person's rights, particularly when it comes to guardianship, which is in essence removing the rights of an individual. So our decisions are not based on cost. They are based upon trying to do what we can in all cases to preserve a person's rights as an adult to make their own decisions.
Okay, thank you, Lori.
I'd just like to say one thing.
No, we're gonna cut this short. It's been a long meeting. You said your thing earlier. She said her thing now. We've heard both sides, so. Okay. Next up is the mental health hospitalization resolution and possible action.
Mr. Chairman, I read it and think it's spot on, and I would like to dispense with the reading if we could.
Well, you want to make a motion?
I would absolutely love to, that we move this forward to the county board for ratification.
Do I have a second?
Second.
Any further discussion? I have one question on the 30-day, that the state will pick up everything after 30 days.
I can't hear him.
I have one question about the 30 days number. Does that mean the first 30 days, let's say January, part of February, pass, and then the county picks up those, and then the state pays the rest forever and ever that year? Or is it the 30, we would pay for the first 30 days in January, February, and then do we end up paying for another 30 days in June, July, and maybe another 30 days in August, September? Or is that just 30 days per year the county will pay for a patient?
I think the intent, when we talked about it, would be the first 30 days when you're placed in Winnebago. What I didn't think about is if they were in there, let's say they come in January for the first 30 days and they're in there for 4 months and then they're discharged, and then 3 months later they come back. You know, I didn't.
Our thought was the first 30 days, and I thought it meant a non-duplicated admission. So if somebody leaves and comes back again, we would be responsible for the first 30 days, is what I thought. If you think it's 30 days for the year, that's a whole different.
Well, my problem with this is that you have your opinion on how it can be defined. Somebody else will have their opinion on how it can be defined. And you know the state's gonna say, you'll keep paying for 30 days, 30 days, 30 days. So I think we need that specifically clarified.
I think I'm consulting Joel, we're thinking if somebody's, if they get placed in there and they're in there for 30 consecutive days and they have to stay in there beyond there, and we couldn't come up with a resolution where to place them, that kind of, it starts getting into outlier territory, that's where we're looking for some help. So it wouldn't be, I see where you're going with this, and I don't know how to clean it up right now, but I don't think it's like they come in one time for 10 days and then they get discharged and come in another 10 days.
Winnebago is basically a short-term hospitalization. Most people are in and out of there in less than 30 days. These are the outliers that we have living there.
Right, and that's what we're trying to deal with. So the motion and the second.
I would make an amendment to my motion that we can put it at 30 days annually or 30 days for the lifetime of the individual, but that we actually take care of that part and note it and it's forward to the county board, because there's many good wordsmiths on the county board.
Yeah, we can pass this on to the county board with our
Clarify the 30 days.
let's get the 30 days things clarified
Yeah, we can.
before it goes to the board.
Yeah,
With our approval.
I would second that amendment to the motion.
Okay, anybody in favor of the amendment to the motion, say aye.
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 Anybody opposed? Okay, the amendment passes. Now the motion itself. Everybody in favor of the motion, say aye.
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 Any opposed? I was gonna say any opinions, never mind. Anybody opposed? None being, okay, that gets passed on to the Sawyer County Board with our approval. Do we need signatures on that?
They're on here, yeah.
Yeah, what we can do is wordsmith that, give you a red line version at the county board to present, and then we can get the signatures at that time.
Okay. Okay, purchase service, budget performance reports. Okay, budget performance report at this time.
The original budget performance report that was sent out and is the one that you've been getting continuously. Dale asked for some other options. So you not only have that budget performance report, but you have a couple other options which are streamlined. I have to say that these are the ones that this one is one that you used to get. And we were requested that it didn't give enough information and that you wanted the detailed one. So I need the pleasure of the board of what do you want from me? I'll give you whatever you want. I mean, one has a lot of information to it and one has not much. I mean, it basically takes everything together, but I don't know. What's your pleasure?
Yeah, anybody want to comment?
I forwarded on to Patty what, just, if you look at, it's gonna be on page 62 of the agenda, or the very last page of the budget performance report. And this is just the public health water testing part. And, I mean, for me, I don't care how much the telephone was, postage was, or FICA. I like having this revenue totals, expense totals. And that, and seeing what percent of the budget that is, the year to date. And that's for me, we see that under the agent of the state, we've got 6% of our revenue totals. They've spent 23%. They're in the black by $32,000. Forgive me. And that's maybe overly simplistic, but that's what I like to see.
Anybody else have any preferences? What do you think, Paul?
Well, I like the more specific one.
More detailed one?
More detailed, I'm sorry, yeah.
I prefer-
But I know the other one, that's fine. You know, what's worse for most of those Patty's comments.
Yeah.
The ruled
That's
up,
what we really wait for.
the rolled up version was what we gave for years. And then I just want to spark for those that have been on the board for a while, that it was Warren Johnson and Kathy McCoy that had me tweak the report down to the one that was there. The next report that was given was the exact same one you got, but it had the expenses and then the revenues and then the expenses per category, like you're seeing the water testing. They didn't like that. They wanted to see it as it is now, where all of the revenues are together and all the expenses are together. The only reason that the sanitary and water are off on its own at the bottom is because they are in their own separate fund balance. Health and Human Services is in the 225 fund balance. They are in a 258 fund balance to keep them separate and their funds separate. That's why they appear separately on there. But I will give you whatever it is that you want. I mean, whatever is most useful.
And if the computer does all the work.
It
You know,
does.
If we can give Tweed this report, and for something like me, something more like that 258 there, you know, the two people you mentioned are both accountants. And if all you have is a hammer, everything looks like a nail. They want to see everything, I'm certain.
I don't know, we're, staff time is at a premium. We really want to ask them to make two different budget reports every
It
month.
would be just like this. This expense total, revenue total. It's the click of a button and move, I believe, so.
Are you liking either one of these others?
Yeah,
This one?
no,
This one here is done, that's done for the entire agency. This one would be done per unit and it'd be like 9 pages long. It would be, this one is Lori's unit as an example. And then you'd have one for mental health and all as our budget groups are. And that's what was added on. But I want the pleasure of everybody here. I mean,
We can get some consensus on what you like as a board. Otherwise, we get 15 opinions and 15 reports. But whatever you want for information, we can get it to you.
I'll defer to the group, so I'm just. I'm gonna bring it up.
Anybody?
I guess because I've been here so long, it really makes no difference, but I've always been satisfied with the performance report, the way it came out. I mean, that's why we have a meeting, is to ask questions if you want more detail.
I'll confess that I've been looking at these performance reports for a long time, and it still takes me a long time to understand them and really get to the bottom.
It does take time.
I guess I would prefer something a little more simplified. If we have questions, we can ask questions.
Right.
okay,
You
what
always have the-
report would you like? Do you want one per unit? Like the one that says ADRC, one for each unit? Or do you want the one that says human services and it's a roll-up of our entire agency?
I would like one per unit.
One per unit,
How
like
many-
Yeah, I
this?
don't know where you're at.
How many pages is that?
It'd probably be like 9, 10 pages long.
And the other one is,
The one you get now is like 30 something.
35, 33.
okay, reasonable compromise. That sound good to everybody?
Yep.
What do you think? Everybody got it? Okay, if that's okay, then we'll move on.
Yep, no big deal. Do you normally get an acceptance of the budget performance report that anybody, you normally get an acceptance, don't you? Don't they work to accept the budget performance report?
No. We-
Yeah.
Yeah, I think we
To
do.
accept, just to
Yeah.
accept it.
Yeah.
That we record, that we,
You shouldn't accept reports.
oh, okay,
Okay,
You can just say it was presented to.
okay,
yeah,
all right.
that's fine. Thank you for mentioning that. Purchase service recap? Or no?
Yep, you share the purchase service recap, it's just a recap of the purchase services. This is another report, do you guys want this? I mean, this is another one that was created and you've been getting all along, but does anybody want it? It basically takes the big ticket items that are in the budget, exactly as they're in the budget by unit, and then tells you where we're expending on them.
I never really got that much out of it.
No, you guys don't need that? To me, that's the one you should be looking at, actually.
I like
that.
That's- To me, if you wanna look at something, I would
I
look
want
at this
that
one.
one.
Before you look at the budget performance report, this is really where you wanna be looking, because if you're gonna bust the budget, it's gonna be on one of these line items.
Right.
I can
And this
see-
would give you a heads up earlier in the year than anything else. I mean, but I would prepare this anyway, because I think I give it to our supervisors, and I think they need to be looking at this all the time.
You know,
And this I look at constantly. And,
it would have been so much quicker if you just said that in the beginning.
well, it's okay, but I mean, if people don't want it, I don't wanna, you
We'll
know.
just leave it
I
like
like
it is.
that one.
Okay,
General consensus, leave it like it is?
Yeah.
I like that.
okay.
Yes,
Okay.
Thank you,
What's your
thank you,
comments
Laura.
on this one?
Okay, because that's the one that I feel is the most valuable to you as a board member, is that's really, because when you look at our budget, if you go back to our budget just for a second, our total budget is $8,481,000. $4,346,000 is purchase service. What the heck does that mean? That report tells you what does that mean? And that's, because otherwise, you don't That's a big number just to be sitting nebulously out there. And that report that I create for you is not a new world. I create that one in Excel for our supervisors to also keep on task with, so that they can see this is what is, not that we can do anything about most of it. I mean, it's not like we have a choice. If a kid goes into an RCC, they go into an RCC, we're gonna pay for it. But at least we can have those conversations of like, wow, is there anything else we can do? Is there something this? Can we work with another unit? I don't know. All those conversations that the conversations that we have in depth with our supervisors at budget time are held on mini basis every month. But and that's.
Okay, thank you, Patty. Residential collection procedure.
Just for transitions, this has been sitting out there for a while, and Rebecca gave her final blessing on us and went through it, so this is what we're presenting to the board.
Okay, is this go to the county board then?
Yeah, because there's a, I think so, doesn't it?
Policy can go to the board, yeah.
Okay.
It's not really a policy, it's a procedure. The collection
Okay, then-
policy was already adopted.
Okay. So this is your internal
Yes.
procedure then?
Yes,
Okay.
and this isn't just for transitions, this would be if someone's, which we actually have several clients now who are placed out of the county at residential facilities because transitions might not be a good fit for them. So it's basically telling our staff how to proceed with trying to collect on those accounts.
So do we need, is there action that needs to be taken on this?
You did make a motion and accept the procedure for the outpatient a couple months ago.
You can bless it if you so desire.
Okay, could I have a motion to approve the procedures for the residential collection process?
Yes, I'll make that motion.
I'll second it.
Okay, thank you. Further discussion? Everybody in favor, say aye.
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 Anybody opposed, say aye. Okay, motion passed. Any items for discussion?
Do you have to vote on the resolution that's related to the procedures?
I think that's what we did.
Oh, yeah. It's a collection procedure, all right. That's still only have to, never mind.
There's a resolution along with that. That's what we're, the motion, I believe, Mr. Schuman, you had it, they were looking at the resolution, not the procedures themselves, so. Right?
Correct.
Tom, they can all sign this then?
Yep.
Signature page.
Okay. Anything other for discussion only?
Yes. Earlier this year, Patty celebrated her 30-year anniversary, and I'm waiting for a time when we can, at one of the full county board meetings, acknowledge her 30 years here. I think it's well deserved. Hopefully you'll be willing to come on the board meetings. I don't know when we can do that, but when we're able to do that, I'd like to have Patty come. So
You bet, and definitely allow that.
acknowledge that.
Definitely allow that, just get over Tom and we'll
Okay.
put you on the agenda somewhere near the beginning.
Sure.
And before you, our board members leave, be sure to sign this. I'll leave it with Paul. Anything else?
Are you passing it around or should we come to you? Yeah.
Yeah, one other comment, I was thinking of that, the big one, and maybe we just have to check this Rebecca's on, but I think the word that we need there is greater than 30 consecutive days. Consecutive, I think, is the word that pops in my mind. That's all it would take. So.
We can ask for the moon and.
Yeah.
Okay.
I just got one last thing. When Patty started talking about these RTZ placements, right? and being mainly tribal children that are there. And like I said, I'd like to have that as a future agenda item and invite Carl and the business to come in and speak to us about that, and how the county and tribal government come together on resolving this or bringing this up here.
Sure,
Okay?
sure.
It was nice.
Next month?
Next month, let's address.
Okay, we're adjourned.
Thank you.
Thank you.